I'm Mark Dresner, and this is MDRP TV, an executive interview series featuring specialists and experts in government pricing and reimbursement programs. Joining us today is Rich Holsapple. He is the Pharmacy Services Manager for HP Enterprise Services for the Oregon MMIS. Rich, welcome to MDRP TV.
Thank you very much.
The Medicaid expansion and healthcare exchanges. So what do you think they're going to look like?
The exchanges they're designed basically to be a shopping place on the web that people can go and buy insurance that can't otherwise get insurance or don't qualify. The expansion part of it is expanding the minimum requirements to be able to qualify for Medicaid. So it's going to increase the Medicaid population. In our state, we're looking at adding about 300,000 lives to the Medicaid population, which is a significant jump for Oregon. Means more people are going to be in Medicaid. The healthcare exchanges are also working with small businesses. It's another thing. Oregon has already set up their shopping area, if you will, and have many plans that are participating in it where people can go and purchase insurance. But for our purposes, it's the Medicaid expansion that's really going to have a big impact, especially with drug rebate. But how it's going to look and how it's going to operate and how the feds are going to make states split that money is still a big question mark for everybody.
Can you elaborate on that? And what about contract pharmacies?
It became a nightmare when the Affordable Care Act started requiring the states to collect rebate for all managed care utilization. The 340B program and its exclusion from Medicaid rebate was already established for fee-for-service. So that was already happening. But what had happened with managed cares had already existed. Companies that are paid by the state to take care of a select population of the Medicaid recipients. And they were doing it their own business, and they had their own side contracts, either with manufacturers or with these 340B entities. Certain pricing contracts were already in place. Well, now that we were collecting rebate on them, we had to make sure that if 340B drugs were being used, we needed to exclude those from rebates to be in compliance with the 340B program and not to be double dipping the manufacturers. Well, we started doing this and addressing it with the managed cares the same way we address it with fee-for-service. And it came to light after the fact that we were doing this that some of the managed cares and the way that the PHS providers were billing them for 340B drugs didn't fit with how we were doing rebate. And so what happened was we were either excluding all their claims for rebate for Medicaid, but they weren't using 340B drugs, or the worst scenario is we were including all their claims in rebate, and they were being careful not to use those 340B drugs for Medicaid recipients on the fee-for-service side, but they were using them on the managed care side. So that created a double dip situation for the manufacturers, one that still exists today, but at least states are starting to recognize it and be more proactive about putting rules in place and helping communicate with the managed care organizations and with the PHS entities about how it should work.
Well, Rich, thanks for joining us today and giving us a lot to think about here.
Sure. Thank you very much for having me.
Pleasure having you. And that concludes this episode of MDRP TV. Until next time, I'm Mark Dresner. Thanks for tuning in.